Hi, my name is Janice Biliadis, and I'm a dental hygienist. And I have been using the most complete and effective implant maintenance tools available today by using Acteon Air and Go first around the implant to remove the biofilm. Actually, that is our main goal with the implants, is not to be scraping around it, but to remove the biofilm that is supra and subgingival. So by using the Acteon Air and Go with glycine powder, I can effectively and efficiently remove the biofilm in seconds. Just a quick spray, using the nozzle, gently placing the nozzle about 3 to 5 millimeters away from the tooth, and using a small circular movement subgingival, I can effectively remove all the biofilm subgingivally up to 5 millimeters with the Air and Go glycine powder. The wonderful thing about the Acteon unit is you have a metal sterilizable subgingival tip that can be used around the implants. You'll only want to use a subgingival tip around an implant if you have a pocket depth greater than 5 millimeters. What you don't want to do is jam it down between the implant and damage the perimucosal seal. So only greater than 5 millimeters. It slides nice and easily around, adapts perfectly to the area. The shoehorn unit adapts perfectly, slides very easily to the height of the contour of the crown, just between the crown, junction of the crown and the implant. So before using anything else, before picking up any instrument to scrape around the implant, which could possibly damage the implant, the first thing I'm going to do is use my Acteon Air and Go unit to remove all the biofilm up to 5 millimeters without doing any damage to the titanium surface. After using your Air and Go around your implant, if you see that calculus is present, you want to use one of the implant protect tips. They come in various angles, left and right, with a wide variety of choices. The easiest way is to place this first using your fingers. Once you feel that it's in there securely, using the wrench, just to do a half a turn, not even a quarter of a turn, to make sure it's securely placed. With your implant, you'll want to use short horizontal strokes, not going apically, because the fibers run parallel to the implant. You also want to make sure that you're in the green zone, always, never higher than 5. Using your very short, light, horizontal strokes, going around the implant where the calculus is being felt. Between using your Air and Go for biofilm removal first and your implant care tips, this is the ultimate implant maintenance protection set.